Okay, let's get started. We're going to look at diagnostic ultrasound today. And one of the things I'm going to point out in this cover slide, this start slide, is the image that you're seeing right here. And it's a little pixelated. Trying to put any of these ultrasound images onto a computer screen is a little less than optimal. But what you're seeing right here is a picture of the abdominal muscles. And we're going to see this over and over again. And this is one of the things that you are going to learn how to produce by the end of this part of instruction. And so you should become very familiar with this, and this is what you're going to be looking for when we're looking to train and look at the transverse abdominis, which is what is shown right here, TRA, transverse abdominis, internal oblique and external oblique. Okay. So again, we see that same shot. The other picture that we're going to look to be able to produce on a reliable basis here, and that's of the multifidus. And we're seeing that right here. This is the multifidus muscle right through here. You're seeing, they're showing the thickness right here from, these are the transverse processes. Just lost my pointer. There we go. Okay, transverse processes we're going to find. We're going to see this kind of like a dragging looking sort of dragging back sort of thing. We're actually going to measure from the tip of that up until, and the SC is the subcutaneous tissue right there, but we're going to measure up to that fascial plane right there when we do a thickness measurement for looking at multifidus. So just a preview of what you're going to learn how to do over the course of learning about diagnostic ultrasound. Okay, so here are objectives, and I'm not going to spend a whole bunch of time reading through these. You can take a look at them. But basically, you're going to learn about diagnostic ultrasound. You're going to learn about the machines a little bit. And the biggest thing down here at the bottom, I want you to be able to get a satisfactory image on the screen so you can find the transverse abdominis, find the multifidus, find the pelvic floor. So you have to learn to spin the dials a little bit on machines. And then the last one is that you've got to be able to get through your lab practical. And so you have to be able to do the ultrasound examination of the transverse abdominis, multifidus, pelvic floor, and then be able to lead your patient through an appropriate exercise progression. So just make sure that that's what you're kind of aiming for as you're learning this, is that you're able to do that independently, find those muscles, show your patient how to contract them, and so you can identify them readily and be able to use the machine in order to do that. Okay, so let's get started. So why use ultrasound for musculoskeletal injuries? Well, the biggest thing is that ultrasound is just great for soft tissue. I get people all the time coming in saying, hey, I think I may have broke something. Can you take a look at this with your ultrasound? Well, it's not so good for bone. All right, so if someone has a fracture, intra-articular thing, you want to use a radiograph or other appropriate imaging for that. But boy, you've got something wrong with a tendon. You think you've tore a muscle, a swelling. Okay, something that's soft tissue oriented. Ultrasound is fantastic for that, and in many cases as good as MRI. So we'll look at the shoulder exam when we get to lab as well. And you'll see for finding rotator cuff tears, it's as good as MRI. Okay, so the great thing about ultrasound allows for real-time imaging of the injury. You can take the transducers, the business end of the machine right there, the probe, and you can see that here in the slide. But you can put that right where the person hurts, okay, as I put there, right on the boo-boo. Okay, so someone thinks they have a muscle tear, you can put that right where the injury is and scan that area. So musculoskeletal or MSK sonography has been used in other countries for a long, long time. It's kind of fallen out of favor here because it's just a little too cheap and too easy. We like our big CAT scans and MRI machines, but it's been used in other countries as a baseline for looking at musculoskeletal injuries for a long time. And it's slowly really starting to catch on here with, it's been here, but our radiologists don't like it because, you don't make much money doing this kind of work. But now other physicians are starting to pick it up, as well as physical therapists. Physicians are starting to use it for guided injections. Okay, so and you'll see when we use our machines, we have some needle placement guides, and you can find the target tissue that you're looking to inject, maybe some anti-inflammatory medication, and put that medication right on target. So it's great for that. And so one of the things that kind of saw a big boost in this country was when I guess both the Australian and the Italian Olympic Games a few years ago, and they were using musculoskeletal ultrasound imaging on field. They had a lot of the athletic trainers using these things and looking at injuries before they went and to ship them off to the bigger places for MRI or CAT scan or whatnot. So anyway, kind of seen a real big upswing in the use of ultrasound in this country in the last about 8 years or so. Okay, so it's fast, accurate. ER starting to use these things. We'll see a picture here in a minute of a little handheld unit that you can wear around your neck. Okay, so the exam is easy to learn, very cost effective from the standpoint of compared to other imaging modalities. Now we're not going to be billing for any kind of just about anything with it at this point, but it's very cost effective when we're talking about looking at different types of injuries. But the big thing to look at here is what this identifies, and that is going to be you're going to be able to easily see these soft tissue things: inflammation, tears and ruptures of tendons, ligaments, muscles, fluid collections really show up on ultrasound, soft tissue masses, various types of other soft tissue lesions, things that you might find, embedded in the muscle, things like that. You'll be able to see very easily with ultrasound. So how did PTs get started doing some of this stuff? Well, the Australians started using ultrasound as a tool for looking at the multifidus and transverse abdominis, mainly using it as a biofeedback tool, but also doing some various measurements and measuring the thickness, looking for atrophy, looking for side-to-side differences in the multifidus, looking at back pain patients. So there's just been a whole slew of articles that were published from the Australian therapy world concerning using ultrasound. And, it started out really as a tool just to do these measurements and see these things. We're talking about all these core contractions. And so somebody had the idea, well, let's look at ultrasound and see what we can see contracting. What motions makes a particular muscle contract. And now it's kind of turned into a clinical tool as well. Okay, so not only can we help our patients visualize that contraction, but we can also, in some cases, do measurements. And that's where a lot of the literature right now is on people learning how to take these measurements. Are they reliable? Are they valid? Can we use a measurement, from session to session? And that's where you'll see some of the published literature going right now. And they're slowly integrating into our physical therapy clinics around the country, and a lot of it due to the influence of the U.S. Army. So they bought a whole bunch of these machines and got them out into their clinics. And so, as those therapists move out into the civilian world, you'll see more and more ultrasounds being used. But every year at conferences now at CSM at the summer meeting, you'll see at least one ultrasound CME course being offered. And so we're one of the first ones that's offering this here in your undergraduate, or I guess it's graduate education, right? So before you graduate sort of education. So, we're probably one of a very small handful of schools that are actually teaching this as part of their physical agents course. So what else can we use this for? And that's probably where we're going to end up getting in a little bit of trouble for ourselves, because it's really easy to say, well, gosh, I want to look, for something else. And I get people all the time walking in the office saying, can you look at my shoulder? Can you look at my neck? Can you look at, my knee? And, the diagnostic area is where we're going to get ourselves into trouble. So it is opening up a little bit of Pandora's box in our clinics as well. But what else might be used this for in the future? So some of the things that we've looked at doing some research on, and that's to look at healing. So let's say something like rotator cuff tear. Right now all our rehab protocols are all based on really based on time and symptoms. But what if we were able to actually look at the healing of that tear and be able to gauge when we're going to be introducing various exercises and tension across the muscle. So possibly we can use it to help document and progress our patients with things like that. And with that in mind, that maybe we'd be able to distinguish between those patients that may respond to conservative therapy and those that need to go to surgery as well. Okay, so by a quick scan, by a quick look at the injury, that maybe we're able to tell that this one's not a candidate for physical therapy. So that's not what we're doing with it right now, but those are some things that might be coming down the pipeline. All right, so right now mainly biofeedback tool and possibly to visualize thickness changes. All right, so ultrasound units, if you're looking to purchase one of these, you can find a good machine for, in the $10,000 range. Used machines, the two machines that we own, or two of the machines that we own are used machines. They're great condition. We got those with two sound heads for less than $15,000. The sound heads is what drives a lot of the price for these things. Sound heads are $6,000 or $8,000 each. We have two sound heads each with these. So each of our units would go for about $40,000. We bought them used. We got a great price. We bought the two of them for about $30,000. So we got them about $15,000 each. Our older GE machine, we paid closer to $20,000 for that. And again, with two sound heads. But as you look at between the three machines, you'll see the quality, the image has improved dramatically in the 2 or 3 years between buying the GE unit, buying the Sonosite units. And then the top end, gosh, there's just no ceiling for the price. They're just, get very, very, very expensive. You could easily spend, $200,000 or $300,000 for machines. Okay, and machines are getting smaller. Great. There were some great ads on the Olympics in the last few weeks, looking at a new machine that GE is selling. And it's supposed to be priced at under $10,000, and you can see the size of it here. It's about the size of an iPod. This is just a demonstration of the V-Scan unit at a conference. They're just showing how it kind of works like an iPod interface. You can see the screen. Great clarity. She's demonstrating that there's Doppler on the machine as well. So Doppler meaning they can visualize the flow of fluid. So you can look for bleeding. You can watch the flow, measure the flow in various arteries. So doing just a quick little scan here. Nice little interface like the iPod. You're able to download images from it. You can see just one finger sort of operation. And in a second here, she's going to demonstrate the cardiac eval as well. Okay, so you can go out and look that up on the web and get a better idea. But anyway, so let's look at some basic ultrasound terms. All right, so the image that we're going to see is based on reflected sound waves. Okay, this is using the same technology as our therapeutic ultrasound, just different frequencies and different machinery in interpreting what we're seeing. We're not trying to heat anything up here, do any kind of affect any tissues here. The transducer or the sound head, that's the business end of the machine. That's what's generating our waves and detects the reflected waves. So, with what our transducer is doing is it's sending out the waves, and then it's waiting and listening to see how they're reflected back, kind of like our sonar idea, like we looked at when we were talking about therapeutic ultrasound. Okay, and attenuation, what that means is that sound energy is decreased from the time it leaves the sound head as it goes through the body, that all interactions, everything it's hitting, okay, any skin, muscle, tendon, are going to be decreasing the intensity ultrasound beam. Okay, and so one of the things that we want to try and do is to achieve maximum detection of that reflected signal. We've got to have the transducer perpendicular to the tissue interface. And you'll see that as we're looking at these images, that it just takes just the smallest movement of your wrist, heel toeing or moving the sound head back and forth, and that makes a big difference on how good an image you see. And that's because of this attenuation, reflection sorts of things. All right, so you'll hear me use the term hyperechoic, and that's when we're seeing a very bright white reflection, or hypoechoic. That means we're seeing a decreased amount of reflection. An area that's free of echoes is anechoic, and we'll see that when we see some fluid-filled structures, so we're not seeing anything reflected back from that. And then you'll also hear the term artifact, and that just means a false structure. You might be seeing something on the film, and I might say, hey, that looks like artifact. Okay, it's just something that's a reflected wave. And there are all kinds of different things that you can see, and that's why, as far as image interpretation goes, it takes someone who's had a bit of training and experience in order to actually interpret the images. All right, so again, very similar to our therapeutic ultrasound, we're using somewhere in the range of 10 million cycles per second. Can vary a little bit depending on our sound head that we're using, but our high resolution sound heads are up in the 10 megahertz range, and we're using anywhere from the lower end, at 3.5 megahertz, right on up to 10 or 12 megahertz at this point in time. Not sure if there's anything higher. About 12 is the highest that I've seen advertised, I think, but there's probably higher. I just don't know. Okay, so just like our therapeutic ultrasound, we have transducers that can utilize a multiple of frequencies. So within the software, you're able to change your 5 megahertz sound head down to 3.5 megahertz, maybe up to 7. And then you've got a 10 megahertz sound head, and that one maybe will range from 8 to 12 or something like that. So you're able to just change that a little bit so you can improve your resolution or change your depth. All right, so how does it go about working? We're sending pulses of sound transmitted into the tissue. Those things are reflected back from different density structures that are there, in the body. Those are returned to the unit, processed through the computer, back to that same old, analog to digital conversion. Can't get away from that stuff. And then how strong that signal was and the length of time that it took for return are how the computer then makes the image. So an ultrasound waveform, again, you can't get away from these waveforms in this class. We've got a waveform right here, and as shown in the diagram, you see that waveform has a wavelength. And as frequency increases, or as the number of these pulses per second increases, the wavelength is going to decrease. Okay, so two factors that frequency does for us. One is that as the frequency decreases, we're able to increase our depth of penetration. So just as in our therapeutic ultrasound, our lower frequency sound heads allow us to penetrate deeper. The trade-off is in how much resolution that we're able to get. Okay, so clicking ahead here, axial resolution. So it's just defining how close two things can be, and that we're able to see those distinctly as two objects. And so as our frequency increases, again, wavelength is decreased and our resolution then improves. Okay, so here's a waveform that's just going to represent our sound head. So if we look at our frequency increases, our wavelength decreases. And just understand that with a decreased wavelength, we increase our resolution. Okay, the smaller that these wavelengths are, the tinier they are, the easier it is to see small objects. Okay, so the other thing about frequency is that our depth of penetration improves as our frequency decreases, just like with our therapeutic ultrasound. Remember, we were using 1 megahertz to get a little deeper, 3 megahertz for shallower. Well, here we're using, say, 5 megahertz. That's our low-end frequency for our diagnostic ultrasound. Our 10 or 12 megahertz is what we're using to get very fine resolution, but it's also shallower. So just keep that in mind as we go ahead. So lower megahertz transducer penetrates deeper, higher used for more superficial. And really, for what we're looking at, we can get away with either of our sound heads, but the 5 megahertz does seem to work. I guess across the spread, a little better. You can use it for deep multifidi. It gets through a lot of soft tissue, gets you fairly good resolution. If you were trying to look at a rotator cuff, you're going to want to have the higher resolution sound head in play. We have both of them for us here. Okay, so again, resolution. If we have the higher the frequency, the better the resolution. And what we're talking about here is being able to distinguish two small objects. Okay, if we don't have good resolution, two objects close together are going to look like one thing. And so as our frequency increases and that wavelength decreases, we're able to distinguish the smaller and smaller objects and tell that that there's two things there instead of just one. Okay, the trade-off there is that our depth of penetration decreases. So with the higher resolution that you want, you're not going to be able to get as deep. All right, so what do we want? Okay, so for the case of what we're looking at for these tears, rotator cuff tears and things like that, we can get down to a resolution of a millimeter or less. All right, so for our physical therapy purposes, do we need a millimeter? Probably not. Okay, but pretty fine gauge there that we're judging a millimeter or less in resolution. So pretty good machine. All right, so the stuff about determining frequency, not too worried about that. So just kind of skip through that part. All right, so what makes up these images? So all of our body tissues have a different density. And so when the sound's passing through those different density tissues, there's a different reflection back from that interface at different times, different strength. And so the velocity of the ultrasound is pretty constant as it goes through tissue, and the determinants of how that echoes back then are the tissue density, what it's the differences in those densities. Okay, so the deltas is what makes it a difference, and it makes a difference for the machine then to be able to pick those up, interpret them, and give us an image. So major determinant of tissue echo is our tissue density. Okay, so here, what we're seeing with any of the ultrasound is just a grayscale. All right, going from white down to black. If we start this down at the bottom, okay, if we're seeing some fluid, we're going to be basically seeing just a black screen. We'll see some pictures, some samples of this in just a second. So the things that we're interested in are soft tissue sorts of things are going to be in the gray region. And then the things that we can't see too much of is in bone. Okay, we're going to get this white reflection, very, very white reflection when we're seeing bone. All right, so if we look at, so here we are, bone, mineral, we get this bright white reflection. And what you're seeing right here, this is the proximal end of the humerus right here, and you're seeing the biceps tendon right there, okay? But this white edge right here is the bone, okay? We're not really seeing below the surface of that bone, and what you're seeing here is more artifact, and we're seeing reflection. So some other different terminology that we can get into here, but just wanted to point out this bright white reflection right here. That is the bone tissue right there, okay? So we're only visualizing the surface of that. All right, so same picture though, and if we look at the fibrous part here, so here we're looking at a cross-sectional image of the biceps tendon, and kind of a preview. This is what's called a transverse view. A transverse, we're looking at a slice or cross-sectional sort of a view. And then above it, in the same picture, we're seeing muscle, right? So this is what muscle is going to look like, soft tissue. They kind of call this a starry night or a filet mignon sort of look. And that, again, here we're seeing a cross-sectional view of muscle. We see a lot of dark interspersed with more white sort of fatty deposits in the muscle right there. And so that's what a muscle is going to look like. Okay, so if we look at what fluid is going to look like, so here we go. We're at the bottom end of that spectrum right here, and here we're looking at showing the sound head back of the knee. This is looking at a Baker's cyst. Okay, so fluid-filled bursal extension right here. Okay, so here we're looking at just that big fluid space like that. Okay, so fluid very easily to pick up, especially when it's where it's not supposed to be. All right, so another couple of examples right here. This is a standard position for looking at the supraspinatus in internal rotation, kind of hand, just hooked into the waistband of the pants like that. And so here again, what we always do is you find something that you know, and there's bone. Okay, there's our proximal end of our humerus right there. All right, and so what we're seeing right here, this is a big old tear in the supraspinatus right here, and then right above it, okay, we're seeing fluid in the subdeltoid bursa right there. Okay, so just a whole bunch of fluid built up right there. So that dark black. Okay, so looking down below at this picture right here, again, here's our picture of our transverse abdominis, internal oblique, external oblique. So a good view of what muscle's going to look like. Okay, kind of that, again, Starry Night or the filet mignon sort of a look when we look at muscle. So looking at the different modes that our machines can display in, we're primarily going to be concerned with the B mode, and you'll see a B button on most machines. So it's also called the brightness mode, and that's just the mode that we're going to be running in. The M mode or motion mode captures basically a small movie as if we go into the M mode. So a bunch of other terms here. Not really going to get into these. We might be talking about them. Probably gain, basically the volume control on this, so you can turn that up. It's going to adjust the intensity, and so if you've got a dark picture, you can turn it up and adjust the intensity. The rest of these things were beyond the scope of what we're going to talk about here today. Just an example of an artifact that you might see, and this is called through transmission enhancement. And so here we have some sort of a fluid-filled cyst in this case. And so what happens is, because the sound energy is coming from the superior part of this image on down, okay, so there's nothing to block the sound energy right here. It just travels through this, speeds up and travels through. Whereas over here, we've got a relative similar density of structure. And so the sound energy is at a stronger intensity as it goes through that. And so we get this bright white looking sort of thing. And that's called through transmission enhancement. So a common artifact that's seen, and you might be focusing on that bottom part, thinking that there's something right there. And actually it's just because of the change in the densities right there. So just one example of an artifact that you might see. All right. So let's look at technique then. All right, so we're going to be looking in two different views. We have two views. One's called longitudinal view. One's called the transverse view. And looking at a transverse view, that's when we want to look at a cross-sectional area of an object. In our pictures right here, in the top picture, we're seeing what he's viewing right here is the transverse view of the biceps tendon. You can see the orientation of the transducer right here. Okay, so you can picture the length of the biceps tendon running underneath this transducer. Okay, and here we have what we're viewing right here. Then is the proximal end of the humerus, and right in the bicipital groove right here is our biceps tendon in cross section. Okay, so to get the longitudinal view, all we do is we flip the transducer, okay, 90 degrees. You just spun this thing around, and now we're seeing down the length of that. All right, so if we look at, if we were thinking about this being a piece of pipe, our transverse view would cut the pipe, so we were seeing down inside the pipeline. Okay, our longitudinal view allows us to see along the pipe, so we would see the length of the pipe. Okay, so just as we start to do these in lab, I think that'll make it a little clearer as you're viewing various structures. But just to note that it's a flipping the transducer 90 degrees. Also, our transducers have a little. They all have some sort of a little knob on them, and that little knob is meant to always be either superior or placed laterally, and that just helps you identify where you're at when you're in a nice dark room, and that superior and laterally then will always correspond to the upper left of the screen, and that just helps you produce a consistent image, and for someone else looking at it to know where you're at as well. All right, so just a couple tips then. You want to palpate to get close to what you're looking for, and find something work from there. In the case of the shoulder exam, we're going to use that proximal end of the humerus and then work from there. Okay, you can see as we look at the subscapularis, you'll be finding the acromion, and so you find a lot of times bony structures, and then look around to see what you're find where you're at. So you find a landmark, work from there. You're going to use very subtle use of rocking the transducer in order to get a good, clear image. You're going to be doing a heel-toe technique, but very subtle rocking of that to get as perpendicular to the object that you're trying to image as possible. Okay, I also recommend anchoring a finger or two to the subject to help hold the transducer steady. You've got the sound head full of gel, and it tends to slide around. So by putting a finger or two in place, that'll help hold the image steady so it's not sliding off. We're going to be using paper towels to clean up our gel mess. You'll find real quick if you're using a regular towel that the gel just kind of sits in that towel, and you'll end up putting your hand or something else in it. And so use a paper towel. That way you can just wipe and throw away as the paper towels become soiled. So you're going to want a big stack of paper towels where you're working, and a trash can. And one huge caution right here is you've got to be very careful with these sound heads. The sound head is fragile. They will not tolerate being dropped, and as I mentioned earlier, they're very expensive. So especially when we're in the dark, we've got the lights off, you need to be very careful with these things. We don't ever lay the sound heads out. When we do the demonstration, I'll show you what I do to help protect them. If you're using one of our machines, we have the racks that will hold them in place. If you're using one of our demo machines, we're going to be taking the cord from that and wrapping it around the back of the machine to help protect a little bit. But you must be very careful with the sound heads. Okay, so the images that we're going to be concerned with being shown right here. So looking at our transverse abdominis, we're going to be positioning our patient supine, and we're going to be moving just superior to the ASIS. And you're going to find that you're going to be moving your transducer a lot farther laterally than what you expect. So if you have trouble doing this, move that sound head laterally. And even with this image right here, I find that moving it laterally, you end up getting a better picture. Okay, and with this sound head technique right here, you're going to end up getting a picture that looks like this. And so here it is again. Here's our transverse abdominis in this layer right here, and that's the picture. Just get that in your mind's eye, because we're going to look for that over and over and over again, and you need to be able to reliably produce that image. Okay, another shot, another cross section showing you what you should be seeing. If you're not seeing it on these black and white images, you should see the transverse abdominis coming like this: internal oblique, external oblique, subcutaneous. And so here's our transverse abdominis again. Again, a little grainy image. It'll be better when we start working with our machines. Okay, rectus, not really part of our exam. I threw this one in just because you can, go out and look at this as well. You can see just centerline technique. Here's what we're looking at: rectus on one side, rectus on the other side. Okay, and fascia there in the middle. Okay, and here we are on the image. Okay, looking at the rectus on one side, rectus on the other side. Okay. And here we are for our multifidus exam. They're doing this one in side lying. We're actually going to teach this in prone, but it's also been shown many times in side lying. You're going to come over the spinous processes and move just slightly laterally. Okay, so they've moved in this case superiorly in this picture, but you're going to find the spinous processes, In our case, we're going to start down here at the sacrum, find the sacrum, L5 space, and then we can count up and we can find the level that we're interested in. And then we're going to move over until we see our little dinosaur ridges like this. Okay, those are going to be our transverse processes. We're going to come across the tip of one of the transverse processes and measure that thickness, okay, from the tip of the TP up to the subcutaneous layer. Okay, so they're showing you muscle right here, but that's not the thickness measurement that we're going to be taking when we do it. We're going to go from the tip on up to the subcutaneous layer there. All right, so hopefully that helps gets us a little bit set for what we're going to be doing in lab. We have machines that will be delivered from Sonosite, and we should have fun doing some imaging this week and looking around inside our bodies. Okay, see you on Tuesday. Bye.